Good afternoon, everybody. I am Adrian Schweer, the director of the Bipartisan Policy Center's Paid Family Leave Program, and I'm so excited to have you here today. The Bipartisan Policy Center is a DC-based think tank that actively fosters bipartisanship, which couldn't be more important in a divided Congress and what we're looking forward to in 2021. We focus on policy solutions that generate from informed debates from both sides of the aisle that have a political viability and the chance to actually get across the finish line and meet the needs of America and especially working families. Our work around paid family leave was born a couple years ago out of exploration on early childhood from the 0 to 5 spectrum and a recognition that new parents may need a national paid leave policy. We look across the spectrum at challenges facing working family caregivers from birth to elder care. And we're really excited today in a time of COVID when caregivers and families have been stretched to the max to explore bipartisan policies that could help meet their needs. We have two keynote speakers from Congress, Congresswoman Jackie Wolarsky and Congressman David Trone, who will open us up and share some exciting policy that they've been working on together to meet the needs of working families. And we'll have an active panel discussion with Dr. Jennifer Olsen and Jasmine Greenemeyer from EMD Serono, and we can't wait to have you here. So first up, we get to welcome two members of Congress who have shown us what active bipartisanship looks like. The first we'll turn to is Congresswoman Jackie Wolarsky from the 2nd District of Indiana.
Good afternoon. I'm honored to join you for this important discussion. Helping working families thrive is among the most pressing issues our country faces. I want to thank the Bipartisan Policy Center for organizing this virtual event to advance the conversation around these issues. And I want to thank everyone who's with us today for your interest and engagement. I represent Indiana's 2nd District, and I serve as the top Republican on the Ways and Means Worker and Family Support Subcommittee. In this position, I've worked across the aisle on common sense solutions to help America's working families succeed. Front and center in these efforts have been issues like childcare and paid family leave, which have only become more urgent amid the COVID-19 pandemic. Both parties agree we need to expand access to paid family leave benefits and quality, affordable childcare options. We haven't reached consensus on exactly how to do that, but we're moving in the right direction, and I'm hopeful we'll get there. Even before the coronavirus crisis, working Americans faced challenges in accessing affordable, high-quality childcare. The pandemic has only made the situation worse. The child care industry has been hit hard by restrictions on class sizes and the cost of added health and safety precautions. In response, Congress and the administration have provided funding and flexibility to support child care providers and help them implement health and safety protocols. With vaccines now being distributed around the country, we are on the path to defeating COVID-19 and rebuilding our economy. Continuing to provide guidance and support to providers as they fully resume operation must be a top priority. We also need to help working families pay for the child care they need. I've been grateful to work alongside Congressman David Trone to offer one legislative solution, the Working Families Child Care Access Act. Our bill would allow working parents to contribute more to their employer-sponsored dependent care flexible savings accounts. They would also be able to roll over remaining funds to the following year. These provisions would strengthen an important tool many working families use to help pay for childcare. And I hope our legislation remains part of the conversation as we head into the next Congress. These are difficult problems to solve, and no two families face the same set of issues. Each and every family is truly unique. Finding solutions to address these issues and put families on a stronger path will require innovative thinking and bipartisan cooperation. I hope today's discussion provides insight into how we can move forward together to support working families and make sure everyone has the opportunity to achieve the American dream. Thank you.
Hi, I'm Congressman David Trone from Maryland's 6th District. Thank you to the Bipartisan Policy Center for the opportunity to speak with you today about such an important issue, supporting working families. As you all know, countless families across the country juggle between being full-time workers and full-time parents. This has only become more difficult during the COVID-19 pandemic. Some parents are working from home and acting as a second teacher for their children. Other parents are frontline workers struggling to find childcare for their children because our schools are closed. This is causing enormous amounts of stress and is taking a large toll on the mental health of Americans. The recent report by the Joint Economic Committee found that more than 90 million American adults likely suffer from symptoms of depressive and/or anxiety disorder. This rate's 3 times higher than 2019. We need to support every family to help them manage these difficult responsibilities at home and in the workplace. Throughout this pandemic, I've worked with my colleagues across the aisle in a bipartisan way to support our country's working families. I introduced the Working Families Child Care Access Act with Congresswoman Wolarsky to give more flexibility to parents when it comes to child care. Our bill will allow parents to access $15,000 from their flexible spending accounts for child care and roll over the remaining funds into the following year. I also successfully urged the IRS to allow Americans to make mid-year changes for health flexible spending and arrangements and dependent care assistance programs. These are unprecedented times, and it's on us to rise to the occasion and support the hardworking people that keep our country going. I plan on continuing to do just that. Thank you for the opportunity to speak to you all about this critical issue. Take care and be safe.
Thank you, Ms. Wolarsky and Mr. Trone. It is exciting for the Bipartisan Policy Center to see 2 members actively collaborating, coming up with creative ideas, especially in these challenging times. Congressman Trone, I know we at BPC have been really grateful that you have gone and supported one of our exchange programs and gone to visit a colleague of yours from the other aisle to learn about their district and help show them about yours. I think these cross-cultural exchange programs are really important to building relationships here in Congress. And I think those types of relationships are what foster collaboration like the one you have with Ms. Wolarsky. It's also exciting to see members from 2 important committees, Ways and Means and Education and Labor, which you both sit on respectively, working together on these issues facing working families. As our panel discussion will really illustrate, working families are challenged like they've never been before. The proverbial work-life balance has always been a problem, but COVID-19 has dramatically exacerbated it. Families need intervention to help balance their needs, especially for vulnerable new babies and aging loved ones, and for the families that are managing virtual school and hybrid school and trying to keep their jobs. These challenges continue to face us in the months ahead, and the year ahead, and who knows for how long. So I'm really excited today to welcome 2 powerful, exciting, extremely accomplished women to this panel discussion to illustrate and illuminate what challenges are facing working families, especially unpaid family caregivers, and talk about some of the policies that we might see come and take shape in the next year. So first, let me introduce Dr. Jennifer Olsen, the Executive Director of the Rosalind Carter Institute for Caregiving. Dr. Olsen comes to us with some pretty unique credentials. In addition to focusing on family caregivers and carrying the legacy of First Lady Carter's work, nearly 40 years of work on this issue, she's also a trained epidemiologist. So when you look at the clash of a worldwide pandemic and its effect on over 50 million caregivers, we have the right expert in the room. So Dr. Olsen, why don't I turn it to you, and then Jasmine, I'll follow up with you, and then we can have an active discussion.
Sure. Thank you, Adrian. There are so many ways where we see caregivers coming into the forefront during this pandemic. I think about the role caregivers play in making sure that their loved ones get the medication or the deliveries that they need, keeping their loved ones on the schedules that they need so they don't have exacerbating conditions and need to show up to the overwhelmed emergency rooms, bringing loved ones home after a hospital stay and taking care of them. So we see caregivers in every aspect of our life right now. And what we have here is an opportunity to think about how we can support caregivers, those 50 million and growing, through more of a population lens. whether it's ways and means or education and labor. I think there's so many elements, so many opportunities to support caregivers across different sectors. What happens where you work, where you live, where you play, and how can caregivers be supported in each of those?
Another exciting woman we have on this panel is Jasmine Greenemeyer, the Vice President and Head of Global Strategic Partnerships for EMD Serono. What's most exciting to me, Jasmine, is that when you look at your work, you're leading and pushing this Healthy Women, Healthy Economies program all across the globe. And you've been studying the intersection of these issues for working women. And I'm excited to hear what brings you to the table today.
Well, thank you, Adrian, for that introduction. So I'm with EMD Serono. We're a healthcare company located just outside the greater Boston area, and we are the U.S. affiliate of Merck KGaA Darmstadt in Germany. But as you alluded to, what brings me here today is I oversee our Healthy Women, Healthy Economies, and our Embracing Cares initiative. And if I boil down the goal to the most simplest form, it's to help advocate on behalf of family and unpaid caregivers, particularly at the intersection of their health and well-being with their economic prosperity. And we're very fortunate in the U.S. that we work with the National Alliance for Caregiving and the Caregiver Action Network through our Embracing Cares initiative. And actually just this past September, we launched a 12-country survey, and the U.S. was one of those countries. And we were looking at how COVID-19 has impacted caregiving, particularly unpaid caregivers, family caregivers. And we saw some themes that won't surprise people, but just the depth and breadth of some of the findings I think are surprising. And we saw rising demands for caregivers, the change in their responsibilities, the immense toll on caregivers, the inequities of caregiving, like again, how it affects women more dramatically, and then also communities of color. But we also saw some themes around path forward as well. So I look forward to discussing some more of that with you both today.
I'm excited to hear more about that survey. Dr. Olsen, you've recently put out a report, and I know there's new data from our colleagues in the caregiving community about how many Americans are family caregivers and the challenges they face. And you often talk about what you call their emergency room moment and the lack of really preventative care and catching the caregiver along that journey before they reach that emergency moment. Would you be willing to shed a little bit more light on what you mean by that?
Sure. Oftentimes when somebody is looking for support in their caregiving role, they're coming to us because of an extreme point of mental distress, overwhelmed by physical health issues, just at a breaking point. And they show up or they Google a caregiving organization, one like ours, often in the middle of the night, and look for support and outreach. We know across all sorts of public health issues that early engagement, prevention, education, and awareness, as well as intentional support for caregivers at each level of their caregiving journey, would be a meaningful way to support caregivers rather than this approach that I say, think about how a website works for that caregivers are recognized on. It'll often be a disease-specific organization that has a sub-tab that's for caregivers. You know, you go down 8 levels and then you find the caregiver page. Or you have to go to your local area agency on aging, which not all caregivers are older or would think of that as the place to go. So we've kind of taken an issue that we know we could apply preventive approaches to, and we haven't done that yet. And we have segmented caregivers by the condition or by the silo, like we would do in other health issues, and say, oh, this is only a surveillance system for this type of condition, and this only works for that. So there's some promising approaches we could take from other health issues across the globe and domestically that could apply here. But I think everyone would agree that it's much better to think about supporting someone at that annual doctor visit than that emergency room moment from a cost and well-being standpoint. So let's try and figure that out.
That's a really exciting potential intervention to think about screening caregivers. We think about them from the care recipient, the person they love, and how that person is affected. We don't really think about the caregiver themselves and their own health outcomes. I find that very interesting to think about screening for that, just like a new mother gets screening for postpartum depression in her checkups. I think, as we mentioned, new data shows that 53 million Americans are unpaid family caregivers. That ranges across the spectrum. We also know that 40% of workers have children in the home under the age of 18. And many of those workers right now are balancing work from home or work in their normal work environment that could potentially be a scary environment in today's world, and the health and well-being of the people they love. May they be children that are home alone, or in my case, outside while we're here in this conversation and hopefully not hurting themselves, or where you are out and you don't have adequate care for your loved one. We're also faced with a really unique environment where elder care facilities are on lockdown and caregivers do not have the access to their loved ones to help manage the care and show their love and provide the care that they normally would. And Jasmine, I'm curious in this COVID world, how you're seeing the data that you pulled from your research domestically and internationally, and what you think it will illuminate for future policy and future conversations and interventions for the caregiver.
Yeah, I think there's a lot to be mined here. We saw the amount of time caregivers are caring has significantly increased. The average is around 7.5 hours additional caring. And then we've seen people are first-time carers. So millennials have stepped in and how they're absorbing and caring for the first time. And also what we saw was working carers and the distress for them because they had the most significant amount of time increased. But as we talked about those secondary layers, when you look at particularly with women, the overall amount of time increased significantly for them, but they're also now making less and spending more in the middle of COVID. So this is just a tension we feel like deserves some scrutiny, particularly from a policy standpoint. But also when we looked at communities of color, we saw that there's a great amount of distress surrounding COVID-19, just feeling more unsafe, but also that at the end of the day, this was the segment where their salaries were decreased the most. So again, just some opportunity, I think, for all of us to consider.
It's a great point. I feel extra challenged with that point today because as we see Congress negotiating this kind of end of the year COVID relief package, which Americans desperately need, and we see a lot of financial interventions there for working families. There's a potential that the direct check stimulus is back on the table. It hasn't been for the last couple of weeks. There's continuation of some versions of unemployment insurance, but there are some working family and financial security programs that are going to pass away and potentially expire with this program. One of them is the emergency paid leave program, which currently isn't on the table to be extended through the pandemic. And that included paid sick days, which for a lot of these workers, they don't have 10 days of paid sick time to quarantine or care for themselves if they are infected or caring for someone who's infected. And then we're also losing a program of paid family caregiving leave, where a lot of these parents were using this paid time off to care for their children when they couldn't serve in their work environment, but it kept them attached to the workforce and off of unemployment insurance. So it's hard to see those programs expiring. And it's a little bit discouraging because I feel like in an environment where we have shown the underbelly of the challenges facing working families and working carers, we have somehow managed to illuminate their challenges and yet not invest in any policies to really meet their needs. So I'm curious, I'm a little downtrodden today, but I want to stay excited in the months to come. And we have a new Congress that is, it's going to be very divided. We just saw a very exciting 908 gang come up with a deal to move COVID relief forward. And we could see this middle out politics moving forward where, there's less of the partisan divide and we can see some middle ground and some true changes. So I'm curious from the two of you, what excites you the most in the year of 2021 on policies that might address the needs of working families and or places where you see opportunities for research or additional kind of highlighting of an understanding of what families are facing. Jasmine, let's go to you first.
I'll go.
Oh, sure. I'll kick it off, and Dr. Olsen, I'll let you go next. So I think, coming out of COVID-19, you've alluded to this is the moment for all of us to understand more than ever what it's like for caregivers, right? So I think that's front and center. So I'm hoping there's a cultural shift to have the political appetite to dig deeper into some of these things. So I know you said some of them are going to need to be refreshed as we come into 2021. And I would add a few components beyond just the fiscal elements that would be so helpful for caregivers and their families. We know, looking at the tax credits and subsidies and things like that are immensely helpful. But I want us to dig deeper on that respite care bill that's in play right now, right? Because we know that just the mental health and well-being, we saw in our particular survey, and I think it's been echoed in other places, caregivers are distressed, immensely distressed. So I'm thankful for Dr. Olsen and others who are looking at the research there. But I want us to make sure that we're looking at the access around mental health, right? And just making sure more caregivers are aware of this service, but just again, increasing some attention around some of the mental health deserts that are out there, and how way too many Americans don't actually have access to this. And our caregivers are asking, coming up in the middle of COVID, that this is an issue more than ever for them. But I think you alluded to paid leave. I'm hoping this is back on the table, for not only family caregivers, but others that also assist in taking care of loved ones. But I also think we have to look at revisiting the minimum wage now, because we know that 2/3 of wage earners are women. And as we look at the decimation in COVID-19, I think that's also an opportunity. So like you, I know there's a lot in play here, but I feel like there's more political will than there's ever been before to address the needs of families and their loved ones.
Dr. Olsen, Jasmine brought up a really important policy vertical that we haven't explored here as much, which is the mental and physical health of the family caregiver. And I know you've done some interesting research recently, and you have some intervention programs that serve the needs of caregivers in those two places. So I'd love to hear your thoughts on that.
Yeah, I think there's a chance for us to think about how that we increase I'll say, the dignity and the recognition of family caregivers across all of our health policy going forward. So if we think about NIH research, and there's opportunities for vulnerable population research, can family caregivers be included in that? When we're thinking about a community of color research initiative, are family caregivers of color also identified and included in that? Are we looking at ways where our Medicare Advantage or other programs have caregiver support, caregiver coaching as one of these new added benefits? I don't know, here in Georgia where I am, we see commercials for a number of things lately, but many of them are for Medicare enrollment, and they talk about getting food delivery or rides to your doctor. And I think, but what about supporting your caregiver? They're a critical element, and that could be a step. Are there ways where our approach to thinking about leave thinks about the contagious elements of disease? Are we going to become a smarter pandemic preventive country after COVID? And are we going to think about caregivers and the role that they play in keeping families and households safe? What are all of those kind of chances that we have to think about keeping caregivers healthy and well? We just finished a body of work with caregivers of those with dementia, and showed that by providing caregivers with one-on-one coaching, virtual coaching, they'll return to their preventive care visits. And why does that matter? Because those preventive care visits will enable care of chronic conditions to keep people out of ICUs or needing some of that more intensive surgery. So there's a cost-saving approach to supporting family caregivers. I think that is a conversation that has to get moved forward. There's a dignity of the role of a family caregiver being seen as a form of work, which goes to, I think, some Jasmine's points about funds, as well as thinking about how other benefits in the workplace could be applied. And I think as we think about physical and mental health and the critical, as Mrs. Carter would want me to say, it's equally important to cover your mental health needs as your physical health needs from a parity perspective. What are we doing to make sure that we're looking at the needs of the caregiver in all those aspects: financial health, physical health, and mental health?
Those are great points. I love when you evoke Mrs. Carter in those ways, because she has a lot of words of wisdom, a lot of words of wisdom. I think as we are discussing the challenges facing working family caregivers, there's a huge part of that I want to bring forward, which is the working portion. And Jasmine, you were talking about how many and how exacerbating the challenges are facing working family caregivers. Of the 53 million caregivers, do we know how many are working part-time or full-time jobs, or any additional details that have come out of your research that are unique to that kind of that worker side of the equation?
I can't speak authoritatively to how many are in the workforce, and forgive me, Dr. Olsen, if you're more familiar than I. I'm also just aware, right, that those numbers may have to be revisited when we saw in September that wasn't it 4 times as many women dropped out of the workforce as men. So there's some implications there. But as we have alluded to, that working caregivers are under more duress than ever as they're navigating through this time. Dr. Olsen, is there anything you could add to that part of the conversation?
I think we've seen more than half of all family caregivers in those AARP National Alliance studies are working in some way. There's also a population of caregivers who leave the workforce or have to retire earlier than planned, and all the long-ranging economic impacts of that, especially for women.
Retirement, security, family,
that's right,
resources, long-term health outcomes. What's really interesting, we did some research on, go ahead. Jennifer,
I was just going to say, it's also important to remember that work is a form of respite for many family caregivers. When we talk to individuals, sometimes it's that opportunity to use and engage in different skills and with a different population that helps you as a whole human that we want you to be. And so when you have to make the choice to leave the workforce, it's a really tough choice, not just on your pocketbook, but also on your well-being. And I don't think we understand what that's going to look like for all those people that have left, the women especially that have left the workforce in these past few months.
I want to carry that thread forward, because at BPC with Morning Consult, we did some research on women right after that August jobs data came out. Jasmine, we did some research and surveyed those women as to why they left, and the populace to understand a little bit more about what was underneath that. And we found some really interesting facts. So one, a quarter of all of the women who left the workforce said that they had to leave for their caregiving responsibilities. We also found that that when we dissected those who left, that there was gender parity for those who were leaving to care for aging loved ones, which is actually pretty in line with some of the macro data we've seen on gender parity for family caregivers of aging loved ones. But for moms of young children who were leaving the workforce for their caregiving responsibilities of children, we saw the women leaving at a 2-to-1 ratio to their male counterparts. And we saw that women who have children under 2 were leaving at an even higher rate. Which could be deeply in line with the, we were already facing some massive challenges with access to quality, affordable childcare, and that has been exacerbated by the pandemic, with a lot of childcare providers being forced to close. And I know with both of you in your work, you've also seen, you talked about respite care, a lot of respite care options, adult daycare options, even the community services that existed in those, in the kind of aging community centers and places where people could go to the gym or get lunch and see a couple friends or play bingo. Those opportunities have really closed down. And so that respite plus the interpersonal engagement that brought a lot of happiness and joy and community connectivity has really been hurt by COVID. And in the months to come, those are parts of our social fabric that we're going to have to rebuild. And it's my sincere hope that in that rebuild, we can bring both dignity and appreciation for this unpaid work. And, it will come in the form of respect and understanding, not just of that work and saying, patting someone on the back and saying great job, or telling them it's meaningful work, or supporting them in that journey, but potentially financial support. Unpaid family caregivers that leave the workforce to provide care don't accrue Social Security benefits because they're not accruing wages. So they don't have the same long-term retirement outcomes as some of their peers were able to stay in the workforce and balance their caregiving responsibilities. And they don't ascend to the same wages and kind of retirement benefits that they would have if they'd had that extra 5 or 10 years in the workforce. So there are a lot of challenges financially that come to working family caregivers that we could potentially bridge with creative policies that would give them more flexibility, reward that work in a different way. And then there's just the bigger picture of challenging the way society talks about values, respects, maybe prioritizes that unpaid work in some way. And it's been challenging to me, maybe even today, just to see, as we're talking about this COVID relief package coming together, the lack of interventions for family caregivers at this massive time of crisis.
Yeah, and that's even looked very different across the states, right? We saw Pennsylvania included caregivers as essential to getting the vaccination right away, and New Hampshire didn't. So I'm curious, there's state and federal opportunities to address this. And again, I just hope we buckle up on that. I did feel a little bit encouraged in seeing the respite bill that's in before Congress. Isn't there now kind of an evolution on thinking about hospice care, where hospice care is going to be reimbursed for people giving in-home care versus having to go into a facility? So I just hope, again, more adaptation as we respond to the various needs of caregivers.
That is promising and exciting. Dr. Olsen, what excites you the most in the year to come? What are you looking forward to the most? What type of work is on our CI's agenda?
I think the biggest element for me is getting in front of different policy audiences to talk about caregiving. It's one of the reasons I was most excited for this invitation today, that we're not going to make substantial change for caregivers by considering continuing to have caregiver discussions out of HHS and ACL, although I'm appreciative of the work that they do. I know that's not sufficient. I think that there's a need to be in every department talking about caregiving. We do some work with the military caregivers, and that is often tied to veteran caregivers. But we know there are active duty military members who are caring for a loved one right now. So what are we doing in that way? Every department could be engaging in these conversations. Every committee on the Hill could be thinking about caregivers. And I'm most excited to get in front of and talk to those different audiences, because I'm assured that almost everyone I speak to will have a caregiver story, either know of someone, have seen and have watched caregiving during this time, or themselves experience that. So let that be the driver for big change, and let that change not just happen in the health sphere, but outside of that.
It's great. Jasmine, I'm curious what's ahead for you in EMD as you're thinking about new research, new opportunities.
Yeah, we're beginning the year in January rolling out our 12 country survey, right? So we involved APAC, the EU5, Canada, and obviously ourselves, and just doing a compare and contrast and looking at hopefully best practices, because we know in many ways Europe is ahead of us as they've thought about how to support unpaid caregiving, and just the cultural nuances of how it's dramatically different about how caregiving is done in, say, Taiwan, and even to compare China and others. So we think we have an important story there to continue to advocate on behalf of unpaid caregivers.
That's great. One thing I'm curious about, and I'd love for both of you to expand upon, is your own personal journey into this space. I mean, Dr. Olsen, you were an epidemiologist and are now running a caregiver organization. How does that happen? And Jasmine, you work for a massive healthcare company, and you're talking about unpaid family caregivers. How does that happen? So I'd love to hear a little bit more about your respective journeys.
Dr. Olsen, did you want to go first?
Sure. Uh, I watched family caregiving in my own family, like many people do. My mom was taking care of my grandmother who suffered with Alzheimer's, and my dad caring for his twin brother. And I saw that my parents were not, um, it wasn't the best of circumstances for them. And they had resources and we had opportunities. And I thought I was pretty good at the Google machine, so I could find them any answer to any question or any service they could sign up for. And I quickly came to learn that there weren't services and supports. And I just didn't understand how that made sense. Now, the irony is my last job was in a role called Ending Pandemics. So I clearly hadn't finished that work when I left to get into caregiving, but I like to think there's going to be a point of intersection in the future. And I think a lot of the opportunities for supporting caregivers can come from broader and other areas of public health. And that's what keeps me going every day. That and Mrs. Carter 8 doors down, keeping us focused on supporting our nation's caregivers.
Yeah, I also have an intersection of the personal and the professional. And when I knew I needed to transition out of my last job for a few interesting reasons, which I'll get to in a second. But I was looking and very intentional about the next company that I wanted to work for. And what attracted me to EMD, Serona, and Merrick KGA was the Healthy Women, Healthy Economy project. And little would I know, 4 years later, I would actually be overseeing the program. But a lot of it is our leadership. We have, one of the very few women CEOs that oversees our company, and she is very serious about looking at gender equity, retaining and promoting women, and she's set some very audacious goals, which I applaud. But just even 3 years ago, when I was in the patient advocacy space when I first joined the company, in talking to patients and their caregivers, identified we as caregivers need care as well, and we demand and should be at the table in the healthcare setting, right? We're quite often the ones transporting patients and our loved ones back and forth to medical appointments. So it just behooves us to be there. And I got that immediately and understood that. And just there's been an evolution, to your point, of intersecting these two programs, particularly around the pandemic, and advocating on behalf of unpaid carers. But I would say in my personal life, I've got a wonderful mother who is right out there, and I would say just an advocate in the 60s, and her spirit still is with me by and large today. And as I was in leadership positions within academia, but also within the nonprofit world, just seeing how women were talked to. I remember in my last job, I was in a COO role, and they said to me, well, your daughter's 2. Why don't you wait till she's 5 and she's in school, and then we'll tap you to go into the CEO role. And I just remember it was like this light bulb went on where I was like, and it's time. It's time for me to look for something else. And it's a fantastic organization. And I think there was just some unintended bias there. And I'm belaboring the point. But again, just an intersection of professional and personal as to why I'm here today.
One of the things that I think is so interesting about the caregiver journey and the working caregiver story is that it's often a silent part of your life that you don't share with others. And, you kind of go through that, what's often very rewarding work on your own and enjoy it and face those challenges all by yourself, but you don't really share those with your community, even your closest community, but especially not your colleagues. So do you, there is a stigma facing working family caregivers, and especially as we are in the midst of a pandemic and going to continue to be in an environment where our personal lives are on display, whether you're working virtually or you're working in person, the challenges facing your life are more pronounced and more present, and you're talking about them more than you ever have before. Does that potentially change the game for a lot of the family caregiver issues?
I think it is important. Yeah, Dr. Olsen, please.
Sorry.
No.
I think it does. I think it does because it, as one of our board members does, she puts her out of office message and includes in it that she's doing family caregiving that day and that she can't be reached. And I think there's this question, whether it's a small child, a pet, or an older adult that walks into the back of your Zoom room, people see your caregiving in different ways, which forces that discussion. The real question for me, or the real challenge for me, is that there aren't, top 10 solutions for supporting caregivers in various workplace settings that a company can pick up off the shelf and be really confident are going to work because of the stigma issues and the culture issues that exist. And I think that makes it challenging. The hope for me, though, is also that CEOs and other executives do share their caregiving story in a variety of ways to bring some of that discussion into the table. Even as we think about policy changes, HR policies that change every year, how are you thinking about caregiver issues in your HR policy documents this year? How are you thinking about all those elements as you kind of look forward to what your organization can do? Jasmine?
No, I love where you've gone to this question because I think culturally we need to lead the way on this topic. And not only celebrating supervisor or team members that are very loud and proud about their caregiving moments, but also recognize on a more larger scale level companies that are doing this right. And I think it starts, with having employee resource programs and employee assistance programs. But I think I'm getting away from the origin of your question, right? Which is to say, has COVID have an opportunity here, right? Is we've got to look into each other's lives a little bit more and children being present, but also to say, like, I, am doing triaging for my loved one who's in a different state and just all the complications related to that. I think people have been more open about this because of what's going on with COVID and how our families are just very front and center, and our loved ones, as we talk about being distant from them in different ways. It's just brought that conversation into the forefront.
I agree. Jennifer, I think your hand came up, but I just want to, before you jump in, I want to remind our audience to please join us with any questions you might have in the chat or text, add the hashtag BPC Live. And sorry, as we're talking about real life shoving into the room.
Beautiful.
It's well timed. I thought, Adrian, you did that on purpose. I think there's an opportunity here around skills, though, translatable skills. If somebody's really awesome at triaging and supporting their caregiver or their care recipient or doing 8 types of insurance paperwork, that's a skill that could be great as you build out your team and your organization. And what is the opportunity there when we think about a lens of maybe a diversity, equity, inclusion lens as we're looking to hire? A family caregiver could be a great asset for a variety of reasons, whether it's their ability to handle the logistics of their role or their ability to deal with the complex family dynamics that come with caregiving. They're probably great mediators, logisticians, and multitaskers.
I think that's a really good transition to an audience question we had, actually, that our friend says, what policies have you seen at the corporate level? Jasmine, you alluded to kind of ERGs and employee supports, but what have you seen at the corporate level that might be modeled in other environments or that could potentially be incentivized through federal policy or encouraged or even implemented as a government program?
Yeah. We've taken it very seriously to look at the emotional support of caregivers in the workplace. And we also, try to do pulse surveys, but also encourage and train our managers and supervisors just to have very proactive conversations because we want to retain our unpaid caregivers. I mean, as Dr. Olsen alluded to, they have quite often special skills, but you want to open the door to say, you don't have to leave the workforce, right? We can look at reduced hours, we can look at job sharing, or we can look at a temporary leave. I mean, let's walk through the various components. But you have to promote that you have these policies and also create, going back to the culture question that I love that you asked, and make it not a penalty for those that do step out temporarily or that temporarily change, their role and how they're participating in the workplace. So again, going back to culture and policies, I think need to be wed for us to change our corporate culture around this.
Yep. Given that it's the work that I spend my most time on, I would love to get your respective opinions on paid leave. As you both know, new data shows that about 20% of Americans have access to a defined paid family leave benefit. From the time I first started, when that number was only 13% had it, we are seeing some dramatic change, but that's almost a decade through this journey. And we're not seeing a lot of tremendous growth with new corporate policies. And when they do exist, most of them are focused on new parents, which is great because 1 in 4 women are returning to work within 10 to 14 days of giving birth. And that is both dangerous for the health outcomes of the mother and dangerous for the health outcomes of and long-term outcomes of the child. But we're also seeing that programs like paid family leave have multiple machinations, one of which is to care for yourself. So a lot of caregivers may have a mental health moment or a physical health moment where they need to take time off. Family caregivers themselves might be taking time off to care for a loved one that's going through chemo, a child that's been in an accident, transitioning someone into new elder care facility. Those policies are really important to keeping that worker connected to the workforce so that they maintain that longevity, and also helping them manage some really challenging life moments that might be taking them away from work for just a short period of time. Do you either of you have thoughts, concerns, kind of visions for how America should embrace a paid leave program, what you think looks right, why you think we might need it?
Oh goodness, isn't it? It's only 5 states right now and the District of Columbia that have paid leave policies, right, at the state level. So, I mean, to your point, when you said there's multiple levels to this, we work with the March of Dimes, and we know that mothers and fathers who are able to take time off during that critical period bond better with their children, and just the health benefits to mothers as well as their children. So there's that level. And you astutely pointed out, I mean, God forbid you lose someone right now in the middle of COVID, the amount of paperwork you need to go through in the grieving period. I mean, it's just going back to, just as a society, where do we step up on these kind of things to better support people navigating these very complicated situations? I could go on this for days, and I'll purposely pause here and Dr. Olsen, defer to you.
I mean, I hate to bring it back to culture, but I was speaking to a large employer maybe 2 weeks ago, and they were offering an additional 12 weeks of paid leave to their employees for any sort of caregiving, whether it was young child all the way through to older individual. You didn't have to justify the relationship or any of the details, no paperwork. And they had such a low utilization rate of that leave because they felt their employees there was concern amongst employees of being judged for taking that time and not being as tough of a worker or as good of a worker. And I see this same challenge when you talk to people about flexibility. So many workplaces have allowed flexibility now, but maybe flexibility is actually creating different burdens and challenges. Oh, great, I can do flexible work, which means at 10 p.m. I can keep working because that's when I'm going to get it in. So I do think there's some work to be done on reframing the way that leave can be used so that those conversations, when companies do make those bold moves, can see people doing that uptake. And I think one way for that to happen is actually supervisor training. If a direct line supervisor knows that you have a caregiving role because you've let it slip, that you have to go pick up groceries for your loved one, or that your in-laws just moved in with you, or whatever that is, that's the opportunity to say, well, we have leave, and here's how to do it, and here's what you need to do to make this happen. So I think we have to find companies willing to make the bold moves, help them build up a culture to prove the use and get people to use it, and then be able to show the value to other organizations.
Oh. You're on mute.
know we've only got a little bit of time here, and I want to just remind the audience to please send in your questions. I love your comments on Twitter, hashtag BPC Live, and we will continue to bring them into the fold here. I want to take us back to one other portion of our conversation, which you both touched on a little bit, which is kind of health and well-being of these working families and these workers that are balancing work and life. And we have seen an increase in access to telehealth. We've seen an increase in access to services and mental health services in some of these programs. What are the opportunities for continuation of those types of policies that you think would meet the needs of working family caregivers?
Jasmine,
I'll go to you first.
Oh, sorry. I love that we're ending on this note because I think this is the singular most important thing that came out of our survey, right? That we saw nearly 75% of unpaid caregivers expressing just feeling burned out, and that increase for millennials. So I think this is such an important point. And I love that we've touched on the component of employers here. I'm hoping insurers step in, but when we think about bipartisan solutions, I go back to just access being something that I hope we take up in 2021. I'd be curious, Dr. Olsen, what else you would add to this?
great to see the increases in utilization numbers wise, but I actually want to say how telehealth changes things for caregivers. If you're a distant caregiver, you may not be able to get to all those doctor's appointments, but if you can join virtually, you can be in that room, in that care conversation. The amount of stress that takes off a caregiver is invaluable. So I just hope as we talk about some of this expansion, we don't think about it just from the numbers perspective and the way it changes our billing and our utilization from that, but also how does it make the experience better for that caregiver? How does it ease their stress in any small way?
And if I can just interject, we're talking about telehealth. I apologize, Adrian. I think such an important point when we talk about telehealth is also training. And we've seen that unpaid caregivers, one out of half of all unpaid caregivers are requesting more training as it relates to telehealth. So I think there's an opportunity there we need to think of. But we also saw in previous work that the medical community, you would think is very savvy in telehealth, but there's also a little bit of a gap there. So just as we continue to think about the huge opportunity, right, that telehealth has enabled for unpaid caregivers to be a part of triaging and assisting their loved one, I think we have to think about that component as well.
Those are great points. Before we get to closing comments, I've got a great question from Josh. Josh says, you talked about the need to better understand the impact to caregivers. Are there pieces of data that EHRs could work to standardize or help collect to improve care of caregivers? Dr. Olsen,
I love this question. I love this
Thanks,
question.
Josh. Great question.
I'm a strong believer that our electronic health record systems are an opportunity for understanding caregivers better for two main reasons. The first is we can ask about caregiver status when we ask about other social determinants questions. Do you eat healthy? Do you sit at your desk all day? Do you get enough exercise? Are you a family caregiver? Great question. We could understand so much and we could follow and support the health of caregivers. The second, though, is an opportunity around from the perspective of the care recipient. You go into the hospital and you might be asked who your emergency contact is. That's a little cold and a little unrealistic. That person might be the person to call if you need a ride home. But who's the person who you lean on, who you depend on? And how is that person tagged, identified, and supported in your EHR record? So I think there's ways, in addition to procedure codes, I could go on and on with this one, but that could be a huge step forward that we could take without significant challenge.
If I could piggyback on Dr. Olsen's earlier point around that those intake questions, I would say to look at a change over time, right? So it's a mini distress screening to be proactive and not just come in at the point that the person is burnt out and then to do care, right, for the unpaid caregiver or family member, but to look at how is this ebbing and flowing and how can we be responsive to that. You're muted again.
Man, y'all, sorry. I want to give a couple minutes for each of you to close out remarks, but I want to say what's been most exciting to me today is to hear us look holistically, not just at, my body of work, which is more the financial supports for the working caregiver, but also the health and mental health and broader well-being and societal shifts that really need to take place for us to better balance this proverbial work-life balance that we're faced with in a more intense way than we've seen in years before, and I think will be facing us with increasing challenge in the years to come. So Jasmine, let me start with you and we'll kind of close out our remarks. And I thank you both for being here today. It's been wonderful.
Oh, the pleasure has been mine to be with both of you. So thank you again for this opportunity and for just intentionally having us talk about a segment of the population that often feels invisible and underappreciated, right? So I think as a society, I just hope, coming out of this pandemic, that we rise to the occasion of, more importantly than ever, systemically supporting this population. So thank you again for taking this up as a topic.
Dr. Olsen?
Yes, I agree. Thank you. This has been fun because it's been across different sectors of our thinking around caregiver support. So thank you for that. And I think we can look with optimism into the year ahead. If we can think about ways to identify and support caregivers throughout every type of list of parentheses of individuals, we have great opportunities there going forward. And Mrs. Carter says there's only 4 kinds of people, and you either have been, will be, need one, or are a caregiver. So all policy opportunities exist if we think about that lens for the American people.
Well, I want to thank you both for being here. Thank Ms. Wolarsky and Mr. Trone for opening us up and showing us the creative policies that we think Congress can bring forward in the year to come. I want to thank our awesome audience. You've been great. Your questions have been great. It's really helped us look holistically at this challenge and think broader than some of the issues that each of us brought to this table. So thanks everyone for being part of this conversation. It can continue on Twitter, on BPC's, on the at Bipartisan Policy Center. We can continue this forward. I look forward to seeing more research from EMD Serono, more research from RCI, and more research from a lot of the audience that's here today.
Thank you, Adrian.
Thanks, everyone.